A very common question that people ask me lately is this. I identify as transgender, but I feel neutral or okay about my body. Should I still go through medical and surgical transition? So in my opinion, for adults, because I work with adults, in my opinion, as a clinical psychologist, if I were sitting across a client who told me they feel neutral or they feel completely okay about their body, but they identify as transgender, I would tell them that, okay, so how do you feel then about your gender expression and gender presentation and your gender role? Let's work on those things. Let's work, in other words, on the social things to make you feel much more congruent, to bring you closer to your trans identity, especially if you feel very comfortable with your body. I would not be talking to you about medical or surgical transition because I just don't see the point. What is it going to do? What is it going to alleviate? If you're telling me you feel okay. A lot of transgender people today, especially who younger adults, feel that. They truly feel okay with their physical body because they're not assigning a gender representation to their physical body the way a lot of us, maybe generation past, do. For that reason, they're really much more interested in modifying, and they still identify as transgender, by the way. They're much more interested in modifying their gender expression, their gender role, how they navigate their world, what gender means to them, or maybe just completely eradicating boxes altogether, and I fully support that. There's a lot more to gender than just physicality, way more to gender than just physical body. So if you're listening to this and you're a young adult or you're an adult and you feel okay or neutral about your body and you identify as transgender and you wonder if you need to go through medical or surgical transition, my answer to you is no. Surgical medical transition is there for people who have gender dysphoria in relationship to their bodies on top of other forms of gender dysphoria, and they really need to have those surgeries to alleviate the severity of that dysphoria. If you don't feel it, I don't see the point in doing it.